Hi, so in this video we will study about the Treacher Collins Syndrome, which is also known as mandibulofacial dysostosis or Fraenkel syndrome. Okay, so embryologically it is the most common first pharyngeal arch defect. Do you know which is other common first pharyngeal arch defects? Yes, Perry-Robin syndrome is also a first pharyngeal arch defect. So why this is important to know that it is the first pharyngeal arch defect? Because the first pharyngeal arch forms the maxilla, mandible, malleus and incus and the muscles of mastication, anterior two-thirds of the tongue. So what will happen in Treacher Collins syndrome if it is the first pharyngeal arch defect? These all structures will be hampered. Okay, so you will find an underdeveloped jaw or zygoma is the cheekbone. Okay, so underdeveloped jaw, zygoma, ear anomalies because the malleus and incus are involved, cleft palate will be there and hearing loss due to malformed ossicles. So here in picture I'm zooming in for you. Treacher Collins syndrome may you will find first of all is hypertelorism, that is there is increase in gap between these two eyes. Then there is the downward slanting of the palpebral fissure, downward slanting. This downward slanting is also known as anti-Mongolian feature. Why anti-Mongolian feature and which is called as the Mongolian feature? Yes, Down syndrome is the Mongolian feature. In Down syndrome, the slanting is in this direction. Okay, but in Treacher Collins syndrome, it is the downward eye will be there. See in this photo, downward slanting of the palpebral fissure. Then there is the malformed ear is there. Okay, then there is dysplasia or aplasia of the major salivary glands. Here there can be dysplasia or aplasia, not proper formation of the salivary glands. Then hypoplasia of the zygomatic bone and maxilla. Here it is mainly the mandibular deformation. Okay, so um, underdeveloped mandible and maxilla is also hypoplasia. In other syndromes which we were discussing earlier, we have seen that there was a prognathic mandible, but here in case of Treacher Collins syndrome or Perry-Robin syndrome, you will see that the mandible is small, retrognathic mandible. Then parrot beak nose is there. Okay, then what are the dental anomalies? Tooth agenesis or discoloration is the common dental anomalies, along with cleft palate is there. Okay, so genetic inheritance may, if we say, so it is also a autosomal dominant type of syndrome, and it is caused by the TCOF1 gene. What is the TCOF1 gene? This is the Treacher Collins Franceschetti 1 gene syndrome. Chromosome 5q32 is involved. Then 60% of cases are sporadic, that is de novo mutations. This is not very important, but you should be knowing is Treacher Collins is caused by mutation in the TCOF1 gene. Okay, craniofacial features are malar hypoplasia, that is the underdeveloped cheekbones, flat midface, micrognathia, small resided lower jaw, retrognathia, downward slanting of the palpebral fissure, anti-Mongolian slant, lower eyelid colombo, that is there is a notch or defect here. You can see a notch or defect in the lower eyelid, often with cleft palate may be present, and also there is absent of lower eyelashes. Okay, high arch palate. Then beak-like nose, which gives a bird-like facial appearance, or fish-like face due to flat face, open mouth and downward eyes. Ear and hearing anomalies is there because the first pharyngeal arch defect. Okay, so atrasia or of external auditory canal, that is external auditory canal is not developed properly. Then there is a conductive hearing loss, which is very common. Then what are the cognitive features you might see? You might find normal intelligence. Okay, and neonatal and functional issues can be there, that is feeding difficulties due to micrognathia or cleft palate. Airway obstruction is common in neonates, may need tracheostomy. Okay, gastrostomy, feeding may be needed early in life. So how do you diagnose it? First of all, you can diagnose it with the genetic testing to confirm that there is any mutation in the TCOF1 gene mutations. Prenatal diagnosis if familial mutation is known, ultrasound in late pregnancy to know any facial bone abnormalities. Management, a multidisciplinary care may be needed: ENT, audiology, plastic surgery, maxillofacial surgery, speech therapy, reconstructive surgeries like eyelid repair, ear reconstruction, jaw advancement, palate repair, orthodontic and dental care, psychological support due to visible facial differences. Okay, so in short, if we want to revise Treacher Collins syndrome, so you remember the word Treacher. TCOF1 gene is involved. RC retrognathia, small jaw, ear malformation, atresia of the external auditory canal, Columbo of the eyelid. Okay, hearing loss is there. ESA eye slanting downwards, anti-Mongolian slanting is there. Respiratory issues in newborn. So here we summarize our Treacher Collins syndrome. It is the most common first pharyngeal arch defect. Another first pharyngeal arch defect is Perry-Robin syndrome. Anti-Mongolian slanting is there. Downward slanting of the eyelids is there. Then the auditory external auditory canal disformation, cleft lip can be there. Cleft palate is there. Hearing loss is there. So these are the common features you might find in Treacher Collins syndrome, also known as mandibulofacial dysostosis. Mainly it involves the mandible growth is hampered mostly. Okay, if you have any doubt you can ask in the comment section. Thank you.